Hi, I am Dr. Scarlett Spain. I am the DNP director, the FNP program director, and assistant professor at St. Mary's College of Notre Dame. I just wanted to record this very informal video to talk about the role of the nurse practitioner for potential interested students. So real quick, who I am, again, I'm Dr. Spain. I am a nurse practitioner. I've been practicing as an NP since 2009. I was one of those students who went straight from high school to nursing school and then continued my journey right away to become a family nurse practitioner. And I have absolutely loved the career that I've created. So again, I've been an FNP since 2009. My career started in a mill, in a steel company, where I started as just a staff nurse practitioner. In my time there, worked my way up to management, where I was overseeing that clinic. We were kind of like a mini ER, wellness coordinator. And then in 2018, in the meantime, I went back and got my DNP. In 2015, I graduated with that. In 2018, I decided to make the jump to academia. So my previous university, I was also the F&P program director over there. So now I'm here at St. Mary's. I've been here since December of 2023. Absolutely love it. I truly, truly believe that St. Mary's program here is an incredibly strong program. We have a lot of variety in ways or specialties for nurse practitioners. So we have our program's 4 years, really, really strong program. Our students do it's 700 and some odd clinical hours. That's direct patient facing hours. And then you have your DMP project hours. So you end up with about 1,000 clinical hours. And again, our program is very, very strong. Our pass rates are at 100%. We have two specialty tracks. So we have the family nurse practitioner track. Family nurse practitioners, again, that's what I do. Absolutely love it. You'll see us more in outpatient settings. You do see people go into specialty if they like. I do occupational environmental medicine, has been my role as a nurse practitioner. I briefly did internal medicine when I first graduated, but have been occupational environmental medicine since 2010. So again, lots of different things that nurse practitioners can do with that F&P degree. And then we also have an adult gerontology acute care degree, which is what Dr. Danny Edson runs that program. She's absolutely incredible. She works with trauma, with a trauma surgeon, and then also as an intensivist. So her and I both, as the program directors, have still very active clinical practices, which I think is really important as we are working with students because we can relate to what is the best practice, obviously, what any current developments in practice and just research. We're staying up to date on it because we do still have those active clinical practices. So I do feel like that is a very important key as you are looking for potential nurse practitioner programs. We also at St. Mary's are starting this August a certificate in Gero Neuropsych, which is going to be absolutely awesome. We are working with a company called GuideStar, which is out of Crown Point, Indiana, and the clinicians there, the physicians, the nurse practitioners are just absolutely wonderful. And with that role specifically, they're looking at, again, older adults and trying to, they may be dealing with dementia, Alzheimer's, trying to increase quality of life for older adults. So really, really cool certificate that we have. Our program is definitely expanding in our offerings. Again, our pass rate's 100%, really, really great program. So nurse practitioners, the U.S. Bureau of Labor Statistics anticipates a 45% growth by 2032 for nurse practitioners. The average salary right now is right at 128,000. That's across the board. So in all states, all different specialties, it's a really, really great job. I do want to talk a bit more specifically about me and my roles, just because it's quite interesting. As mentioned, I started in the steel industry. Absolutely love that job. So I would take care of any injured workers and then also make sure that people were fit to work. So if somebody was having cognition issues, memory issues, if they had a stroke, if they had a heart attack, making sure that they were safe to go back to work. Obviously, when you're thinking about steel industry, there's a lot of dangerous moving equipment. So part of my job was making sure that people were safe to work, that they were fit to operate cranes. When I went into academia again in 2018, I maintained my practice. So I still work about a day a week in various different occupational health settings. I work at a gas refinery. I still work in the steel industry. I work at local outpatient clinics. So we have 5 outpatient clinics that, I'll see firefighters, police officers, again, any injury sustained at work. So I see human bites, I see needle stick injuries, I see severe injuries. I've seen fatalities, unfortunately, in my career, severe traumas, anything that has to do with work and having people work safely. I also do surveillance exams. So surveillance exams is if people are exposed to asbestos, silica, certain different OSHA regulations, I'm going to be examining them to make sure that there is no unwanted side effects from these exposures. So that is part of my job. I also work as editor-in-chief of Stat Pearls for their occupational health content. I do writing. So I write, I publish, I can get paid for those presentations, for publications. I do that. And my academia is obviously my full-time job, but one of the coolest jobs and that I get asked most often about is that I work as a healthcare consultant. So I work as a healthcare consultant since 2020 for a staffing firm. And they actually found me on LinkedIn when they hired me. My role there was to keep people safe at work during COVID. So talking about, safety with wearing masks and trying to prevent transmission. During my time there, I've done a lot. So I also built out a plan for a southern state in regards to their COVID clinics, their vaccine clinics. So how did we have to transport the vaccines? What temperature did they need to be kept at? How did the flow go for the clinic? Who was going to come in to receive the vaccines? Lots of different stuff. My job there recently has kind of went more into scope of practice. So I'm the only NP with the company. So if we are placing, again, it's a staffing firm. So if we're placing an NP in Colorado, they will kind of tap me on the back and say, Scarlett, what do we need for a collaboration? Do we need a collaboration in the States? Can you help us write it? And I look at all that stuff. Recently, I was offered a job in Saudi Arabia that I did accept. This has not launched yet, but really, really cool prospect here. And it is going to be, I'm going to be overseeing an advisory team to kind of bring OC health and workplace safety to Saudi Arabia. So that is very, very cool. So as from me talking, you can see the role of the nurse practitioner is very expansive. There is a lot that we can do, and it sometimes will be outside of a clinic setting. So I feel like I have truly created the career of my dreams in regards to, I'm a mom, first and foremost, but in regards to having flexibility, time with my kids, and being able to make really good money with the flexibility and doing things that I love. So I'm still directly impacting patients, which I absolutely love. So nurse practitioners, we look at health promotion, disease prevention, education, and then even counseling. And a lot of NP roles are varied. Again, it depends on your specialty, it depends on where you're at. My role as an NP, I'm pretty independent, meaning that I am in a clinic by myself and I can call my collaborator if needed. I just took one of my daughters to Lurie's last night. Their way that they use nurse practitioners is a bit different. Nothing wrong with it, just different. And so how they work when I go to Lurie's with my daughter, the nurse practitioner will come and get the health history. She'll do the assessments, she or he, and then they will step out of the room and consult with the physician. The physician comes in and says, is there any further questions? The nurse practitioner has already developed the plan. This is kind of where we're at. So nurse practitioners do home visits where they could go to people's homes and assess for their safety, make sure that their medications are where they need to be, that there's no contraindications. Again, it's a really, really cool job, and there's just so much that can be done. Lots of different ways to collect a paycheck based on being a nurse practitioner, depending on kind of what you're in. So again, I just wanted to record this quickly just to talk briefly about the role. I am happy to speak to anybody that has any questions. I feel like I'm very transparent and very much an open book in regards to this job. And again, it has been absolutely incredible for me. I'm super passionate about helping to prepare our next nurse practitioners as well. So you're getting this video again because you have expressed interest in St. Mary's College of Notre Dame. So please, please, please reach out to me. We are still accepting applicants for fall. and would love to chat with anybody that has any questions. So again, my name is Scarlett Spain. You can reach out to me at spain@stmarys.edu. It's S and then Spain like the country, SSPAIN at stmarys.edu. And I really hope to hear from some potential students and talk to you further about what an amazing career this is and how incredible St. Mary's College is, because it truly is an awesome place. Our faculty are really strong when we're looking at overall faculty engagement in the students, faculty research. We have the nurse practitioners have active clinical practices where we incorporate info directly from our clinical practice into our course didactic and clinical work. So I hope to hear from some of you. Thanks so much. Bye-bye.